Good afternoon. My name is Patrina Mister, and I am your nurse leader. Today, we will discuss the role of the nurse leader as a mentor, educator, and change agent in a healthcare organization. Evidence based nursing aims to provide holistic, quality care informed by current and relevant research and knowledge rather than traditional methods, advice from colleagues, or personal belief systems. By collecting, processing, and implementing research findings, nurses can expand their knowledge and improve their clinical practice experience. Evidence based practice focuses on the patient at the heart of nursing. It incorporates evidence based practice into everyday patient care by understanding what it is, why it is essential, and how to do it. Patients can benefit from evidence based practice in nursing in addition to keeping healthcare practices relevant and current. Patient outcomes can improve, healthcare costs can be reduced, and the overall quality of care is enhanced by using evidence based practices. In addition, nurses can collaborate to identify the best ways to provide patient care by creating a culture of collaboration. Evidence based practice also reduces healthcare costs, increases nurse autonomy in decision making, and ensures relevancy in nursing practice. Through evidence based practice, nurses can combine evidence based practice with clinical experience to develop the most effective care plans for their patients. Evidence based practice helps nurses provide the best care possible while reducing unnecessary treatment and procedure costs. Additionally, evidence based practice allows nurses to make decisions independently and become more involved in their practice. An essential responsibility of the nurse leader is to serve as a role model for the healthcare team and its members. Communicating each team member's goals and expectations is critical. Essentially, everyone needs to know their role and the roles of the other team members to work together in attaining common organizational goals. Nursing leadership begins at the bedside. By developing and honing their fundamental leadership skills, bedside nurses can positively impact patient outcomes. Nursing leaders coordinate, direct, and support patient care and other healthcare team members. Additionally, they serve as patient advocates and possess practical communication skills. Nurse leaders can also mentor and support nurses, ensuring they remain up to date with the latest advancements in healthcare and understand their roles. In creating a safe and effective environment for patient care, nurse leaders can foster a culture of collaboration and understanding. Nurses can also provide quality care with the assistance of resources and support they provide. They can help identify potential problems and develop solutions to mitigate them. Nurse leaders can help ensure that nurses are held accountable for their actions and the quality of their care. Furthermore, nurse leaders can help create an atmosphere of trust and respect, which is essential for providing quality patient care. Nurses are change agents in any capacity that they work. Nurse leaders promote change by leading relationships, processes, and culture, and using supportive, reflective, and cultural bearing leadership that permits genuine and sustainable changes. The practical nurse leader leads interpersonal relationships through an ethical approach of respect, trust, and concern to ensure a trustworthy relationship. Interpersonal relationships will promote effective change processes and cooperation within the organization. This quote here states that change is not merely necessary to life, it is life. It represents the life cycle of the change process that a caterpillar must grow through to become a butterfly. This is the exact change process nurse leaders must guide and support with through the journey of change within a nursing organization. Nursing leaders serve as an agent of positive transformation and best evidence based practices. The nurse leader is essential in guiding and supporting nurses and other healthcare professionals. They provide direction, education, and mentoring to help healthcare professionals develop the skills and knowledge needed to deliver care effectively. They also act as advocates for change, helping to identify and address issues in the healthcare system that can be improved. Evidence based nursing practice improves patient outcomes, enhances quality of care, and advances the nursing profession. Nurse leaders play a vital role in integrating evidence into practice. They establish a culture of continuous improvement and ensure that the latest research informs patient care. A nurse leader must be able to analyze how things are currently working, identify areas for improvement, and formulate a plan to implement evidence based practices. In addition, the nurse leader must provide training and support to foster an evidence driven culture. A nurse leader must also ensure that the evidence is used ethically and responsibly and that its implementation respects the patient's autonomy. The nurse leader must also be able to identify any potential risks associated with the implementation of the evidence and any potential barriers to its successful implementation. Ultimately, the nurse leader needs to ensure that evidence is implemented safely, ethically, and beneficial to the patient. Thank you for listening and being informed.